So thank you very much for the conference organizers for having me here today. So almost 1 in 10 Canadians cannot afford their prescription medications. I used to be a rural family doctor in British Columbia for many years, and many of my patients did not have employer drug plans. They did not work for the government, and in fact, the majority of them were self-employed, and many of them lived close to the poverty line. I remember a patient called Joe. He was a seasonal worker in the resource industry. He had severe hypertension. Joe could only afford his medications 1 month out of 3 when he saved up enough money. The other 2 months, his blood pressure was severely out of control. Occasionally, a drug rep would come to the remote area I worked in and drop some samples off. So occasionally, Joe would get a couple weeks of one kind of antihypertensive. Another month, he might get a couple weeks of a different one, neither of them really the one he needed. Joe had a brother, Sam, who lived in the Atlantic provinces where there's higher deductibles on the provincial plans, and Sam could not treat his high blood pressure at all. So these are the patients I want everyone to remember as we go forward in the debate about Pharmacare. So the CMA has been advocating for a national Pharmacare strategy for a number of years now. And in our recent pre-budget submission, which I did to the federal government, we called again for a national pharmaceutical plan and strategy. Under our Healthcare Transformation Initiative, which includes the principles of patient-centeredness and of equity, we actually are strongly advocating for equitable access, i.e. coverage for all Canadians, regardless of their income, and equity of access across jurisdictions so that your drug coverage is not dependent on the postal code where you live. So our vision is very clear. You can read it there. The goal of a Canadian pharmaceutical strategy should be to ensure that every Canadian has timely access to safe and effective prescription drugs, and that no Canadian is deprived of needed prescription drugs because of an inability to pay. How are we going to get there? And it's a very challenging road. The CMA believes strongly that our first and our pressing priority right now, right here today, is to have coverage for all Canadians. So we need to identify those who are uninsured and those who are underinsured. Our priority is to target those gaps, and that's where the CMA is putting our effort right now. So my patient Joe back in rural British Columbia, he cared about only one thing. He cared about his health. So Joe was doing his best. He cut his salt out of his diet, he quit smoking, he was walking, he lost weight. But he still found that he needed his medications, and he couldn't afford them. Joe actually didn't really give a hoot about how he could afford his medications. He didn't care whether it's paid for by a government plan or someone else. He just wanted his medications, and I think that's how a lot of patients are. So our concern at the CMA is that if right now we don't fill in the gaps of those people in desperate need, that we don't work first of all on filling in the gaps, that it may take a long, long time before we get an entire vision of a whole reformed system in place. And so that's where we're putting our efforts. We know right now the federal government is not much engaged in this process. We would like federal vision and leadership, and we continue to advocate for that. But first of all, we want to fill those gaps in, and that's where my patients want the help right now. So again, we know that, as some of the other speakers have alluded to, that Pharmacare issues only one part of what we need. We actually need a pan-Canadian comprehensive strategy, and this has to include effective and safe prescription drugs. So we need very strong post-market surveillance mechanisms. We need an adequate supply of prescription drugs. Those of us who practice, and a lot of patients know that over the last year we had severe drug shortages. Some of these continue. Many of my patients could not actually get proper pain medication in the emergency room. We ran short of a lot of the very important drugs we use. We also need optimal prescribing by health professionals. So we need accountability and we need outcome measures in our drug prescribing. So we have a huge challenge. We look forward to be part of the dialogue going forward, and thank you for this opportunity.